Welcome to the video series, Occupational Therapy for the Stroke Survivor at Home. My name is Alyssa. I'm an occupational therapist and certified stroke rehab specialist. If you're a stroke survivor or caregiver, my goal is to provide you with information and advice to help make your lives easier in the home setting. Any information I reference throughout this video series will be made available to you in the video description. Let's get started. This episode, we are going to focus on bed mobility. What does this mean? Bed mobility refers to the ability to move or assist someone with moving in bed. Being able to move in bed is a critical skill necessary for improved independence and serves as a foundational step for getting out of bed. So, throughout this video, we are going to demonstrate and discuss strategies for rolling in bed, sitting up from a lying down position, and transitioning from sitting up to lying down in the bed. I'm going to also address the importance of being able to move in the bed, as well as tips and tricks along the way to help improve independence and quality of life for stroke survivors and caregivers. Keep in mind as you are learning, no one stroke survivor presents the exact same way as another. The techniques shown to you in these videos are simple and effective. However, there may be strategies that work better for you and your caregiver, and that's okay. Let's first talk about rolling in bed. The ability to roll side to side may be significantly impaired if one side of the body isn't functioning the way it once did. However, being able to roll in bed is a foundational skill for sitting up, getting out of bed, finding a comfortable position in bed, and for self-care tasks. A stroke survivor being able to roll, and roll well, can be incredibly helpful for caregivers if they are assisting the patient with dressing tasks, hygiene tasks, or even promoting skin integrity. Therefore, it is necessary to learn how to roll or how to help someone roll in bed. Before we get into the demonstration videos, let's review some helpful tips that you will see unfold throughout the videos. Rolling with the strong side towards the weaker side of the body tends to be easier. If you bend or assist to bend the knee that is opposite of the direction you are rolling, it can help shift the momentum and make the roll easier. Reach across the body to roll, or if one arm is unable to reach across, try placing the weaker arm across your midsection to help position the body in the best possible way for rolling. Always, always, always protect an affected arm. Pay close attention throughout the demonstrations where the caregiver places their hands on the patient. We never want to pull on a weak arm, as this can cause greater damage to the stroke survivor. Lastly, don't hesitate to consider different equipment or strategies to make your lives easier with rolling in bed. I will review the benefits of using a draw sheet and even using a bed rail to help someone roll in bed. Let's take a look at some demonstrations. In the upcoming videos, the person simulating a stroke survivor in bed is wearing a yellow band on the wrist and ankle to note the weaker side of the body so that you can better apply these skills at home. Typically speaking, rolling towards the weaker side using the strong side should be the easiest way to roll. As both the person in bed and caregiver, this is important to remember. More than likely, the person in bed will be able to roll further and do more independently than going the other way. Therefore, for dressing tasks or hygiene tasks, you may choose to roll this way first in order to get a larger percentage of one of those tasks completed before needing to roll the other way. Be on the lookout in other episodes to see how to complete these tasks in bed. So, for rolling towards the weak side, the stroke survivor is going to bend the stronger knee up and push through the leg to help get the hips around to roll. At the same time, they will use the strong arm to reach across the body to roll. Bending the knee and reaching across the body encourages a momentum, allowing the roll to occur more easily. The caregiver can place their hands on the hip and shoulder blade to provide assistance in rolling if need be. This should get you to a side-lying position, preparing you for the next step or even for comfort. This next clip shows the same technique with rolling, using the stronger side to the weaker side. The difference you will note is the use of a bed rail. This bed is a hospital bed where the rails are available on either side. However, for home use, you can purchase bed rails that can easily be installed on one or both sides of a standard bed. The bed rail provides the person in bed with something to pull on, giving some leverage with pulling, potentially improving independence with rolling. Another important note in this clip is that when rolling towards the weak side, you want to be mindful of where the weak arm is and try not to roll over it. Therefore, slightly place the weak arm away from the body, so that when the person in bed rolls, they don't roll directly on top of the weak arm. Throughout the series, you will see other benefits that a bed rail can provide as well. Though a bed rail may be helpful, remember, it's not necessary to be able to roll in bed. Although rolling towards the weaker side is most likely easier, it is most beneficial and can improve mobility and self-care independence to roll towards the strong side. The principles remain the same. The person in bed is going to bend the knee opposite of the direction they are rolling, reach across the body, and roll. However, because this is the weaker side, the person in bed may have limited use of either or both the leg and arm. Therefore, the caregiver may have to assist more with this roll. So, the caregiver may assist to bend the knee. Note, the caregiver will likely have to keep a hand on the knee to maintain this bent position. Additionally, the caregiver assists the person in bed with bringing their weaker arm across their midsection. The person in bed can hold on this arm to protect it. The caregiver should prepare to assist more with this roll. Therefore, be mindful of the body mechanics, not arching the back and bending at your knees. Place one hand on the hip and one behind the weaker shoulder, and provide enough force to gently guide the person with a roll. Again, we have successfully achieved a side-lying position. In the next clip, I want to pay closer attention to caregiver hand placement to prevent any injury for the stroke survivor and to improve technique for the caregiver. It can be difficult at times to get proper hand placement on the person in bed when helping them roll. However, it is necessary to have proper hand placement to avoid injury and reduce pain with rolling in bed. One hand is going to be behind the shoulder. Never pull on the arm, and always guide from the part of the limb that is closest to the body. In this case, this is behind the shoulder, over top of the shoulder blade. The other hand will go over the hip or top of the buttocks. This avoids unnecessary pressure on the low back and avoids pulling on the weaker leg. Good hand placement will make the roll much easier for both the stroke survivor and caregiver. Another effective tool to use to assist with rolling is the use of a draw sheet underneath the patient. Simply place a bed sheet or a washable draw sheet or disposable draw sheet, which can be found online for purchase, underneath the patient. Notice in this video, the first thing the caregiver is doing is pulling on the draw sheet to scoot the patient over nearest the caregiver prior to rolling. This allows more room for rolling, which can improve how far over the person in bed is able to roll. The caregiver should be mindful of their body mechanics when pulling the draw sheet. Pulling the draw sheet pulls the person's hips over in the bed. The caregiver then adjusts the shoulders and legs to align the patient in bed. There is now more room in the bed for the stroke survivor to roll towards. Next comes the roll. The principles remain the same as before. Bend or assist to bend the knee, bring the arm across the body, and allow the person in bed to hold the arm. The difference is, the caregiver will now grab a hold of the draw sheet and use it to roll the person in bed. This is beneficial to use with larger individuals or individuals who have significant weakness on one side of the body and are unable to assist themselves. Now that we have mastered rolling in bed, let's review the next step for mobility, which is the transition from sitting up from lying down, or vice versa. In order to transfer out of bed, we have to be able to sit up. And in order to transfer back into bed, we have to be able to safely lie down. Transfer techniques are reviewed in another episode, so be sure to check that out as well. Before we get into the demonstrations, let's review some important tips. First and foremost, a full roll onto one side is going to be helpful when sitting up. This is yet another reminder not to pull on the affected arm when sitting up. It may be more tempting to do so when trying to help a stroke survivor sit up. However, remember that this causes more pain and can result in injury for the stroke survivor. You'll note in the upcoming demonstrations that supporting weight through an elbow while side-lying can be a helpful skill with these transitions. When sitting up, before taking hands off of the person in bed if you're assisting them, or before transitioning either to a new surface or within the bed, be sure the stroke survivor is maintaining good posture with hips, shoulders, and legs aligned to promote the best position for balancing while sitting. Lastly, consider the use of a draw sheet to help with this transition as well. Let's first review techniques for sitting up towards the strong side. The first step is rolling towards the caregiver. You may notice the rolling principles remain the same. However, the caregiver is on the opposite side of the person in bed than before. This is because the person in bed is soon to transition to sitting up, and the caregiver needs to be on that side of the bed to be in front of the person rather than behind. The hand placement remains the same, but requires the caregiver to reach over the person in bed. Once we've achieved a roll to side lying on the strong side, the caregiver assists the person in bed with pulling legs off of the bed by placing hands behind both knees. The caregiver then places one hand on the hip and the other hand behind the shoulder. The caregiver will pull up with the hand behind the shoulder and press down on the hip to create a momentum to assist the person in bed to sit up. Encourage the stroke survivor to engage their core to sit up and use their strong arm to push up from the bed. Note the caregiver then ensures that the hips, shoulders, and legs are aligned prior to taking hands off the patient to ensure they are balanced on the edge of the bed. While we are seated here, let's go ahead and talk about transitioning from sitting to lying down towards the strong side. The stroke survivor can be instructed to lean towards the strong side and bear weight into their elbow. Be sure the elbow is aligned with their midsection or slightly in front, as placing it too far behind will make the transition more difficult. Once the stroke survivor is on their elbow, the caregiver can assist with bringing the legs onto the bed, placing the person in bed on their side. Simply assist with rolling the person in bed back to their back, if desired, but be sure that, again, the hips, shoulders, and legs are aligned. Now let's show sitting up towards the weaker side. Again, the first step is a good roll towards the weaker side, in which the person in bed can bend the opposite knee and reach across the body to roll. The caregiver can reach over top and place one hand on the hip and then one hand behind the shoulder to pull the stroke survivor into a side-lying position. Once here, the caregiver can guide the feet off of the side of the bed. Note, the stroke survivor has hooked the strong leg around the weaker leg and can use the strong leg to drag it off of the bed in one movement. The stroke survivor then uses the strong arm to reach across their body to push up from the bed. In this clip, the stroke survivor uses the bed rail to push up from for more leverage when sitting up. The caregiver still places one hand on the hip to push down and one hand behind the shoulder to pull the patient into a sitting position. Once up, the caregiver and stroke survivor should ensure the hips, legs, and shoulders are aligned for balancing on the edge of the bed. You may find on occasion that once sitting up, the person in bed is too far back in the bed, or their legs are sticking straight out, or finding it difficult to maintain balance. The person in bed needs to be scooted forward so that they can be properly aligned to promote good balance. If there is a draw sheet placed underneath them, the caregiver can assist with scooting the person forward more easily. Sometimes it can be easier to scoot a stroke survivor forward by scooting one hip at a time. The weak arm should be placed in a lap so that it is protected. The stroke survivor then leans towards their stronger side so that the caregiver can use the draw sheet to pull the weaker hip forward. The stroke survivor then leans towards the weaker side in which the caregiver should be prepared to assist with this due to the stroke survivor likely requiring greater assistance for balance. Once leaned over, the caregiver can pull the draw sheet to scoot the stronger hip forward. Leaning opposite of the side of the hip you are wanting to come forward is a critical piece to this technique. It essentially takes the weight off of the hip you are moving, making it more manageable. Once forward enough, be sure the body is properly aligned and balanced. Lastly, let's demonstrate assisting a stroke survivor with lying down towards their weaker side. For this side, it may be easiest to cue the stroke survivor sitting on the edge of the bed to scoot their strong hip backwards on the bed and reach back with their strong arm to support their trunk. The person in bed can bring their strong leg to the bed while the caregiver assists to bring the weaker leg to the bed. Once on the bed, the stroke survivor can be assisted to lying on their back. As we finish up this episode, let's recap what we have just learned. We reviewed techniques for rolling in bed and the importance of being able to roll to improve mobility, self-care, and to reduce caregiver burden. We showed methods for sitting up and lying down, which are necessary steps for both getting into and out of bed. We talked about using a draw sheet or a bed rail to improve independence with these tasks, in which these items can be found and purchased online. Lastly, and importantly, we discussed different strategies to implement in order to avoid injury as a caregiver and to prevent any further injury for the stroke survivor. Thank you for watching. I hope this video helped you as a caregiver or stroke survivor with maximizing independence and improving your quality of life in the home setting. Please utilize the comment section below with any questions or comments about the video. Stay tuned for more episodes. Thanks again for your support.